Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
Now we're going to talk about ophthalmology, and that's, of course, the diseases of the eye or the non-diseases of the eye, just so that you take care of your eyes and you don't have to... Sorry, I'm not trying to have people not go to an ophthalmologist, but if we take care of our eyes, we're going to... If we go once a year or however, you're going to check. So Dr. Mario Del Cid, C-I-D?
Correct.
Did I pronounce this right?
That's right.
Okay. Is here. He's board certified, and he's actually a native of South Florida. Where did you grow up?
Well, so I actually moved around a lot growing up. We settled down here about 20 years ago, so I feel like I'm a native of South Florida. I'm as native as most people can be from South Florida, as it turns out. So we've been here in the Weston area, actually, since I was just after high school.
Okay, and you decided, why did you decide to be an ophthalmologist of all the medical specialties?
Yeah. You know, I found the eye. I find the eye to be just a really fascinating structure. And going into medical school, I didn't know what I wanted to do. I knew I wanted to do something surgical and maybe combine a little medical. And I'm kind of a technology geek. And as it turns out, ophthalmology provides the best of all worlds: a little bit of medical, a little bit of surgical. And as it turns out, we tend to be on the cutting edge of a lot of just advances, a lot of technological advances in surgery and medicine. And so it just seemed to combine everything that I really loved about the field of medicine.
You know, we know so little about the eyes. We see, we look, but we don't really, we can see our nails, our feet, but we don't really get it. We just know if we can't see, then we have a problem, right?
Yeah, the eye is a really complex structure. I usually use the analogy of comparing the eye to a camera. I say the eye is the world's fanciest camera, and it's composed of lots and lots and lots of different structures. And not only the eye itself, but the eye connects to the brain. And so the interconnections between the eye and the brain are also extremely complex. And so because of that, any issue along any one of those components or pathways can cause eye disease. One of the most frustrating things I find when I see a patient, they might tell me, I've been slowly losing vision, but I just thought I was getting old. And that's really frustrating because, as it turns out, yes, some things do tend to age and degenerate, but in general, a lot of eye diseases are treatable. And especially if you catch them early, they're potentially reversible. And so I think it's really important for your listeners to understand that vision loss is not normal. And if they're experiencing vision loss, they should definitely get checked.
Well, I'm going to throw something to you. I've said this to some people. I have a rare form of something that's great. It's called second sight.
Yes.
I'm 78, and I don't need anything. I can see probably the tiniest thing. And I've talked to ophthalmologists, they say, well, and it's hereditary, apparently, 5%, they said, and my mother had it, and my mother lived to be 94, but they did say that at any time you could lose it.
Yeah.
And so I'm hoping I'm not going to lose it. So what can I do to take care of the second sight? Anything?
It's probably not.
Why don't you explain to people what this is? I'm sorry.
Well, second sight, so what happens is you slowly begin to lose vision as you age, particularly with the formation of cataracts. Cataracts is when the lens in the eye starts to get a little cloudy. It's like having a dirty pair of glasses. It's also associated with a hardening of the lens or a change in the shape of the lens. And so what can happen is, as you get a little older, everyone starts needing the reading glasses, right? Probably starts around the age of 40 and progresses into your 50s.
And I did use them at that point.
Mm-hmm. But as that lens itself starts to harden, it actually changes shape. And when it changes shape, it might change into a conformation such that, hey, you don't need reading glasses anymore. Isn't that something? And you may not even realize it until one day you lose your reading glasses and you're out and about. You're at a restaurant, you got to look at the menu, and you're like, wait a minute, I can see this menu just fine.
Right.
And as it turns out, it's because the lens in the eye has changed shape to such a way that it's actually okay for you to see it near. And most people can continue to see pretty well at distance. So that's what's called second sight. Now, what can happen is, as that lens changes further, or as the lens itself starts to cloud a little more, then your vision can start to diminish. And at that point, the lens can't change anymore. That's pretty much just going to progress And then at that point, you may or may not need to consider cataract surgery or going back to some glasses.
Right. So I was waiting for you to come in here so I could explain that to people because
Yeah.
I'm always having a little problem with that. But typically, I think you were saying that macular degeneration is probably one of the most difficult eye diseases for people to deal with.
Yeah. The thing is, it's the leading cause of blindness in those over the age of 60 in the United States. And it's such a common disease. It runs in families. So, most people that have it will tend to have family members that have had it. And another misconception that'll happen is, well, they'll say, well, my grandmother or my mother had it. She went blind from it. So I didn't think there was anything that could be done for it. As it turns out, there's actually quite a bit that can be done for macular degeneration now. Macular degeneration has two forms. There's a wet form and a dry form. So the dry form is by far the most common form. About 90% of people with macular degeneration actually have the dry form. What happens with dry macular is you develop these little spots, these age spots, medically they're called drusen, in the center of the vision in the area called the macula. The macula itself is the fine focusing point of the eye. It's a part of the retina in charge of your center of vision. Switching gears to the camera analogy, the retina is like the film in the camera, okay? So it has nothing to do, we were talking about the cataract before in the second sight, that has to do with the lenses. This has to do with the film in the camera. And so if you develop these little spots or age spots in the center of the vision, it starts to obstruct or impede the vision. Some people with macular will notice blurring of vision, especially that central vision. That's what you need for the reading and identifying small letters, etc. So most of my macular patients will tell me when I look at you, I can see your face. I can't see your face, it's kind of blurry, but everything around you I can see just fine. I can see the clothes you're wearing, I can see the monitors, etc. Next to you, but your face is a little blurred, and that's what macular affects. It also causes distortion of vision. So many people will tell me, when I'm looking at tile, there's an area in the tile where things will look wavy. Very, very common symptom of macular degeneration. Unfortunately, the dry kind, we don't have effective therapy for. There's no good treatment to reverse it. However, there's a lot of information about things you can do to stop it, prevent it from getting worse. It is called degeneration for a reason. Without intervention, it will tend to slowly progress, but there's a lot of things you can do to prevent that from happening. So the first is to eat healthy. There's lots of good data to show us that eating leafy green vegetables, things like spinach, kale, things with antioxidants in them, can stop the disease or at least slow it down. Controlling risk factors for other eye disease. So these are things like diabetes, high blood pressure, cholesterol. It turns out when you have macular and you have these other conditions, they can have a synergistic effect and actually accelerate the disease. So if you can control those, you can reverse that. Exercise. Obviously, exercise is good for a lot of different reasons, but as it turns out, it's also good for the eye. Watching your weight. Obesity is also shown to accelerate the disease. Not smoking. Smoking is one of the biggest reversible risk factors for this condition, so it's critical for smokers not to smoke or be exposed to smoke. And the last is the use of an eye vitamin. Many people have seen eye vitamins advertised, and they're advertising them for everybody, all comers. Anyone who feels like they need an eye vitamin just for general eye health should take it. I'm a little more judicious in how I recommend it. I usually recommend it for macular degeneration patients, but there are lots of data. Large government-sponsored trials have demonstrated that the use of eye vitamins can actually slow the disease down significantly. So those are things you can do in terms of just prevention or slowing things down from the dry macula.
I don't know. Well, let me tell everybody, Dr. Mario Del Cid, CID, is a board-certified ophthalmologist, and he is here he practices, I guess you have your own private.
Yeah, so we have an office,
yeah.
a large office right at Imperial Point. It is a private practice, but we're affiliated with Broward Health Imperial Point.
Right, the Retina Group, right?
Correct.
Well, it's interesting to hear physicians now talk about vitamins and eating healthy, where years ago, I remember many years ago, I was, my physician was a cardiologist, and I had been investigating a lot of things, and I started taking vitamin C and vitamin E. He laughed. He said, he said they didn't, I guess, he was an older gentleman. And then before he gave up his practice, he told me, are you having enough vitamin E and vitamin C? So things have changed, haven't they?
Absolutely. And this is backed up by lots of good evidence now. It used to be vitamins, absolutely, were sort of hogwash. I don't know about this. A lot of disbelief about vitamins, but we've, over the course of the past decade, have accumulated a wealth of evidence that vitamins are actually extremely effective at managing a lot of different conditions, and the eye is no different.
Now, you talked about dry. What about wet macular degeneration?
So in wet macular degeneration, what happens is you develop these new little blood vessels underneath the center of the vision. So the dry oftentimes gives form to the wet. These new blood vessels start to leak and sometimes even bleed into the center of the vision. As you can imagine, that tends to cause much more problem in terms of vision, distortion, etc. Now, 20 years ago, we didn't have very good treatment for this condition. What we used to do was laser or cauterize these leaky vessels. The problem is, if you're lasering or cauterizing right in the center of the vision, guess what? You're going to lose a lot of your vision. And what we would say is, well, let's hope this laser therapy, which will cause you to lose some vision, will cause less damage than if we do nothing at all. Because unfortunately, if you leave that alone, it will progress significantly. Over the past decade, we've uncovered some medications that actually seal these vessels, get rid of blood and fluid, in many circumstances stop the disease, and in even more circumstances can actually improve the vision. And that's been a dramatic turn compared to what we had, say, 2 decades ago. Now, these medicines, unfortunately, have to be injected into the eye. And when I say that to a patient for the first time, you can't imagine the reactions that I get.
You're going to put a shot in my eye, right?
You're going to put a needle where? But as it turns out, it's such an effective therapy, and it's become so common for us to do it. We've become pretty good at it.
And of course, you numb the eye.
We numb the eye completely. The majority of people don't feel a thing. If they do, it's usually a pinch mosquito bite type sensation. It's not as bad as you think. The medicine gets in the eye. It seals these vessels. Oftentimes, people will notice an improvement in their vision within the first week or two. The second problem with the medicines is they do have to be re-injected periodically. Initially, it's every 4 weeks, which again is a fairly intense regimen. But oftentimes, after a series of a few injections, in many patients, we can start to wean them off of the medicine. And in some patients, we can even stop the injections. Unfortunately, in some, it's difficult to get off the medicines, and they continue to require it for long periods of time. But again, given the options that we have available at current date, and certainly given what could happen without treatment or what used to happen with the laser, these medications have really revolutionized the way we treat the wet macula.
I'm so glad you're on the show, because we've never had anyone really discuss the macular degeneration the way you have and explain the wet and the dry, and that's terrific. And of course, I think what you said, people should be eating healthily, they should be exercising, they should watch their weight, and of course not smoke. And then I guess it's very important that people protect their eyes from the sun. We haven't really gone through that, but can you get macular degeneration if your eyes are
right?
affected?
There's a lot of controversy surrounding that. That we don't know for certain if you do or you don't. Macular is more common in those of European ancestry, as it turns out. And so those are your fair-skinned, lighter-eyed individuals. And as it turns out, they're more prone to lots of eye conditions and skin conditions, especially if they're exposed to bright sun, such as here in South Florida. So although I don't know the answer to that question, I oftentimes do urge most of my patients to use sun protection. First of all, it's going to protect the maculas, but it's also going to protect, one of the most common places to get skin cancers is on the eyelids.
I've never heard that.
Yeah, absolutely, because it gets exposed to a lot of sun. If you think about the sun coming from, from up top, it's
right.
One of the first places it hits is the forehead, the ears, the back of the neck, and the eyes. And so it's a very common, and the skin itself is a very sensitive, thin skin. And so it's actually a very common place to get skin cancers. Now, most of them are benign skin cancers, but you can get some other types of skin diseases. So for that reason alone, I think it's real important just to wear large sunglasses, brim hat, etc. Just here in South Florida, it makes a lot of sense to do that kind of thing.
Right. And just going down the list of some other very important diseases of the eyes, and I know we have just a little time left. Glaucoma. We hear about glaucoma, and is glaucoma able to be treated so that people don't go blind?
Absolutely. So that's another condition that's come a long way over the past several decades. Glaucoma itself is high pressure in the eye, which then damages the nerve in the eye. So that's how the disease works. There are different types and forms. Some people have normal pressure with nerve damage. Some people have high pressure with no nerve damage. So there's a lot of variation there. But it's a disease that's also come a long way because the medical therapies have changed a lot. It used to be that this was a surgical condition. Now we have about 6 or 7 or 8 different eye drops that have really almost eliminated the need for eye surgery for glaucoma. So it's one of those diseases that needs to be caught early because unfortunately the nerve damage is irreversible. So anyone that has a family history of glaucoma, ask around, ask your relatives. If anyone's had glaucoma, you should definitely get your eyes checked because that is a condition that has a very strong hereditary component. And again, because it's irreversible, you want to get that caught early. The treatment is usually eye drops. That's all it takes. Now, of course, in advanced cases, there are surgical options, etc. But in most people, eye drops are all they need.
And do people know they have glaucoma? Do they feel something in their eyes, or is it they go? That's why we don't want to forget people who I think who are over the age of 65 should probably go. Definitely every year, but probably twice a year to an ophthalmologist. Should they know?
Yeah, I think anyone, first of all, family history is really important for a lot of these things. So if you have a strong family history and you're concerned about the possibility you may develop the condition, I wouldn't wait till you're 65. I would get your eyes checked now because if you have early signs of it, again, what I said before, catching things early. Certainly after the age of 60, everyone should have their eyes checked once a year usually. If you find something that might be concerning, you may need to get your eyes checked a little bit more frequently. But at the very least, once a year.
Yeah, so that's very good advice because people don't realize till you can't see. We see these commercials on television with people who are blind, and I don't know if that could happen from a lot of different reasons, but. Vitamins for your eyes, that's good. I'm glad you mentioned that. And also all the other good aspects of it. But just go see an ophthalmologist. And now, I've been to ophthalmologists and they have all these things I have to, of course, read charts and you look at the eye and you can see those diseases in all that equipment, can't you?
Absolutely. Again, that's how technology has progressed. And we have so many new imaging modalities. We, for example, for macular, use something called an OCT, which can actually look at almost individual nerve cells in the eye, in the retina. The resolution is so good that things that we may not be able to identify with the naked eye, we can now identify thanks to our imaging modalities. So, again, in terms of early diagnosis, it's really helped us identify eye disease at a very early stage. For monitoring, there's lots of different machines and lots of different computer systems, lots of different tracking mechanisms that we have. Again, it's all just in an effort to monitor, catch disease early, and help us manage patients.
And your practice is probably for the older adult. Do you ever see children?
We don't usually see children. A lot of these eye diseases, for example, the glaucoma, the cataract, the macular degeneration, etc., are much more common in older adults. But believe me, children also get eye disease as well. There's lots of very good pediatric ophthalmologists here in the area. So anyone with any questions about eye disease for children should definitely see a pediatric ophthalmologist.
And people who used to spelling bees know the word ophthalmologist, one of the hardest words to spell.
That's right. Well, some people used to say that the one way, ophthalmology is sort of a competitive residency to get, especially now. And they said, well, one of the biggest screening tools was if you couldn't spell ophthalmology, you were definitely not going to get into a residency. So, yeah.
Floaters.
Yes.
Everybody's had floaters, and are they dangerous, or how do you avoid them?
I'm so glad you brought up floaters because I hear it all the time. And some people are so concerned about them that it's almost like they're stressing over it. And some people are not concerned enough. Floaters are basically bits of protein that float in the liquid or gel media inside of the eye. The eye is full of gel, just like Jell-O right out of the refrigerator. When you're first born, it's nice and firm. But as you age, it does start to break apart a little bit. Seeing a few little floaters here and there is pretty common, and that's just a normal process. Those don't worry me a whole lot. However, if you wake up one day and you have a whole host of new floaters, a shower of new floaters, if they are associated with flashing lights, what I mean by a flashing light is you walk into a dark room, you close your eyes, and you're seeing a fireworks show in your vision. Or if they're associated with any decrease in vision, especially the peripheral vision. So I'll tell my patients to close the other eye and make sure their vision is intact on the sides and on the top and the bottom. The issue is these three symptoms can sometimes be associated with tears or detachments of the retina. And as it turns out, that's an emergency because a tear in the retina can develop into a detachment of the retina, and a detachment of the retina can then permanently damage your vision if it's not fixed. So, new floaters associated with flashing lights or any peripheral vision loss needs to see an ophthalmologist immediately.
Oh, good advice.
However, a few little floaters here and there, don't worry about it. We all get those.
And they just disappear, don't they? They
tend to fluctuate a little bit. Some people are able to just eliminate them sort of mentally. They're able to just kind of forget about them. Some of them do break apart and sort of settle to the bottom of the eye, and they get away from that center of vision, so you don't see them as much. Again, they do recur. I use the analogy of a snow globe. If you shake a snow globe around enough, these things will shake around, and if you sit still enough, it'll settle down. So a few little floaters, again, not a big deal.
Okay, that's good. So Dr. Mario Del Cid, that's DEL and then CID, a board-certified ophthalmologist. He's associated, he works over there at Imperial Point, the Broward Health Imperial Point, but he's part of the Retina, Retina Group of Florida. If you want to reach him for an appointment, you can call him at 954-776-6880, or you can go to his website, which is retinagroupflorida.com. Well, it's interesting now that we are looking into stem cells. And I mean, that's a whole new thing that I've been reading about, that maybe one day people can have their sight restored. Mm-hmm. Is that something, being
Absolutely.
a techie?
Yes. Absolutely. There's a lot of very interesting research, especially for the dry. Remember I told you the dry, we can't reverse it? Well, that may actually turn out to be not true if stem cells work. There's a lot of interesting research now where they're actually injecting these stem cells right into the macula. Now, technically, that's extremely difficult to do. Because it requires a probe kind of stuck into the back of the eye, and these cells are then sort of released right into the macular area. But what they're starting to find is that these cells can actually regenerate lost tissue. And some patients are actually starting to recuperate some vision. Now, we're talking about patients that had no vision at all, basically seeing black or almost black, starting to be able to see movement, motion. There's some interesting videos I've seen of people that were before wheelchair bound because they were scared, they couldn't walk or move, now being able to maneuver around a room unassisted. That's an amazing advancement. Another interesting thing to talk is people that don't have any vision. We're actually implanting electrodes into the retina. These electrodes are basically little microsensors, just like you would have in a camera. That can actually see light. These electrodes then send a message via a pair of glasses, and these patients are actually able to, again, they're able to maneuver around a room without bumping into things. It's incredible that blind people are actually able to now become functionally mobile thanks to some of these technological advances. And this is actually being surgically applied into people's eyes now. So this is a technology that's now available.
Well, Dr. Do I say Delcid?
Delcid, yeah.
Delcid.
Mm-hmm.
Dr. Delcid, you've certainly sparked a lot in us. And if you see those flashing lights, that's not fireworks, right?
That's right.
But it's been wonderful talking with you. And again, if someone is looking for a good ophthalmologist, an excellent ophthalmologist, let's say, 954-776-6880. Thank you for joining us this morning.
Thank you for having me. It's been a pleasure.